First of all, I think the Biden administration needs to invest in a global strategy to stop new variants from emerging that are related to COVID-19, as we saw with the Omicron variant, which emerged likely from South Africa, that if we don't vaccinate the rest of the world, we all remain vulnerable to new variants. And my biggest fear is that a new variant will develop that has the transmission potential of Omicron, but the fatality rates of Delta. So I would advise the Biden administration to do more to vaccinate the global South, to speed up production of vaccines in the global South, to release intellectual property so that the countries can do it themselves, and to provide technical assistance and support to countries for rolling out vaccination strategies in the global South. Secondly, I think in the US, there's much that can be done to mitigate the impact of the pandemic on the vulnerable. So first of all, I think, vaccinating those who remain unvaccinated needs to continue to be a priority. The Supreme Court did allow for mandates to continue for healthcare workers, for example, but there may be other types of workers who are also at risk of getting and spreading the virus. The Biden administration could do more to encourage OSHA to put in those kinds of regulations to protect those workers. Third of all, I think more can be done to provide testing and masks to the American public. And I know the Biden administration has rolled out 500 million free tests, and they're planning to roll out N95 masks, which are more protective. But I would continue to support those efforts. I also think more needs to be invested in treatment. For example, we have some good treatment, some good antiviral medicines now, but they need to be ramped up. Perhaps the Defense Production Act needs to be used in order to ramp up production of those treatments so that they can be accessible to all people who need them. And to continue to put pressure on the unvaccinated, perhaps by issuing a mandate domestically to require vaccination for traveling domestically, to continue to encourage states and localities to put in mask mandates and to require vaccination. And I think more could be done on that front by the federal government to encourage those things to happen. And finally, just to focus on health equity. There's more that we can do to reach those who are vulnerable to the virus, who are immunosuppressed, who have chronic conditions that put them at risk, those who have not been able to access vaccines or treatments. We need more investment in public health infrastructure and communities in order to really close the gap on, let's say, for one example, boosters. We need more equity in terms of racial and ethnic populations who have access to boosters. So I think with a better public health infrastructure, more investment in public health, we could close that gap.